morning. My name is Priscilla. I will be the respiratory therapist performing your PFT today, or your pulmonary function test today, if that is okay with you. Perfect. Just before we get started, I wanted to go over a few things with you. For some of these tests, I am going to have you just sit upright, kind of open up those airways. We're also going to be using some nose clip for some of these tests, and these are just going to go ahead and just clip your nostrils just to prevent any air from coming out of your nose, just because we do want good quality tests. We are also going to be using this filter, and this is going to help us perform our test. So what we're going to do is kind of bite down on this mouthpiece and then form a tight seal with our lips, kind of like this. Awesome. So for the first test we are going to be performing is called an SVC. And an SVC is the slow vital capacity. And this is going to be looking at the volume in your lungs, or how much volume your lungs can hold. I will go ahead and explain this for you now, and then I'll go ahead and demonstrate it. So what we're going to do is we're going to start with just 3 to 4 slow breaths. And then we'll go ahead and inhale as big and deep as we can, and then we'll go ahead and exhale as slow and as far as we can. And I'll go ahead and demonstrate that for you now. So 3 to 4 just normal breaths, 2, 3, 4, and then big deep breath, big, and then exhale slow and as far as you can. Perfect. Let's go ahead and get started. Awesome. Now we're going to go ahead and perform the FVC, or the forced vital capacity. And this one is going to be looking at the volumes and capacities in your lungs. This is the most common PFT test performed. And I'll go ahead and explain it to you and then demonstrate it for you, and then I'll have you go ahead and do it. So how we're going to do this test is we're going to go ahead and just start with normal breathing. We're going to take a deep, huge breath in, and then we're going to blast it out as hard and as fast as we can. And then we're going to go ahead and take a nice big deep breath in. And I'll go ahead and demonstrate it for you now. So just kind of normal breathing at first. And then big deep breath in. And then blast it out as hard and as fast as you can. And then big deep breath in. Perfect. Let's get started. Next, we're going to go ahead and be performing the DLCO test. And what this test looks at is how easy it is for gas to cross the AC membranes in your lungs, or it looks at diffusion. So what we're going to do for this test is just a little bit different. We are going to be adding like a gas mixture just when you inhale. It's going to feel dry, a little unusual, so don't be alarmed. That's just us adding the little gas mixture. It's not dangerous. It's just, we just do want to look at that diffusion. So what we're going to do for this test is we're going to go ahead and take 3 to 4 just normal breaths, and then we're going to go ahead and blow out all the air in our lungs and keep blowing as far as we can. And then we're going to go ahead and inhale as big as we can, big breaths. And that's when you're going to feel just kind of the dry and unusual mixture. And then we're going to hold that breath for 12 seconds. I know it's going to be a little hard, so I'm going to go ahead and be here all the way, kind of coaching you and counting down the seconds for you. So don't worry, I'll be here. And then we're going to go ahead and hold that breath for 12 seconds and then exhale. So let's go ahead and get started. Okay, the next test we're going to be performing is the MVV, or the maximum voluntary ventilation. And this one is just going to look at how effectively you can blow air in and out of your lungs. This one's a little different. I'm going to have you sit down for this one. So what we're going to do is we're going to go ahead and breathe hard and fast, in and out for 12 seconds. And I'll be right here with you, coaching you just every step of the way, and also counting down. This one's just a little tough, so if you need a break or anything right before, let me know. So we're gonna go ahead and sit down, sit up straight, and then we're gonna go ahead and breathe in and out, hard and fast for 12 seconds. Awesome, let's go ahead and get started. Alrighty, next we're gonna go ahead and be performing the peak expiratory flow. And this one is the most commonly used for our asthma patients. And this one is just looking or measuring at the ability to push air in and out of your lungs. So this one is pretty simple. We're gonna go ahead and just inhale really big and deep, and then exhale just fast. Just kind of like we're blowing out some candles. So again, just pretty easy, but still kind of important. So we're gonna go ahead and just inhale and then exhale fast. Awesome, let's go ahead and get started.